This is Charter Local Edition. I'm Brad Pomerance. We are coming to you from Washington, D.C. We are joined by John Fleming. He is a member from the great state of Louisiana, of course, a member of the U.S. Congress. And so I would like to speak with you about the Affordable Care Act.
Yes.
In some states, the rollout has been fairly straightforward. Other states, it's been a bit bumpy. How is the Affordable Care Act rolling out in Louisiana, as an example?
Well, in Louisiana, it's like really most states, it's doing very poorly. The exchanges are very narrow. In most cases, there's only one insurance company, therefore not competition. And we all know that competition is what gives people choice and lower cost.
Now, Louisiana is on healthcare.gov, correct? Which is the federal exchange?
Yes, that is right.
But only a couple, maybe one insurance company has signed up?
Right, because you see, because of certain rules that are already in place, you find that in most states, one insurance company has 70–80% of the marketplace. And so again, one of the things that we want as conservatives is to open up those state borders and make insurance companies compete across state lines.
I've heard that, and I'm wondering what's the status of that, because I'm not sure that you would get so much opposition from your friends on the other side, or would you?
No, the Affordable Care Act actually makes that worse. It actually reduces competition. It increases rates. Many
but
people,
on the issue of crossing state lines?
No, there's nothing in there that facilitates that at all.
So here's the question. I think it's fair to say Republicans think the ACA has some problems. Even Democrats think the ACA has some problems.
Yeah.
Repeal, I think, could be difficult right now. 4 million have already signed up. Query where the president's going to sign a repeal.
Right.
So can you and your friends in the Democratic Party get to a place where bona fide fixes are made to the ACA?
Well, remember that we Republicans have attempted over 40 times to try to fix it in some way or another. In some cases, repeal, yes, but in other cases, fixes, and they've refused to work with us, and then the president would go unilaterally and do the very thing that we tried to pass through legislation.
I know there have been delays.
The other side will simply not work with Republicans, and we're never going to fix this thing and get it working unless the other side is willing to work with us.
Are we getting closer, though?
No.
Really?
Not at all. No.
It's that grim.
It is that grim. The Affordable Care Act, Obamacare, whatever you want to call it, in many cases is unraveling. Actually, we have a net loss of 2 million people who are covered. You said 4 million are covered, but we lost 6 million.
What about the Medicaid expansion? That has caused some consternation amongst folks on the right. The Supreme Court, of course, said that states cannot be required to accept the expansion, but some Republican governors have accepted the expansion. And I think about a state like Louisiana, which does have a high uninsured rate. Would it be a bad thing to accept the expansion per se to get more people signed on?
Well, look what you're expanding. You're expanding Medicaid.
Yes.
Medicaid reimburses far below cost to providers, which means that a relatively small number of doctors and clinics accept Medicaid for payment. So what good is carrying a card around that entitles you to care when nobody can accept that card without going out of business? So what happens is they go straight to the emergency room where they went before, and they clog up the emergency room and the costs go out of sight. So Medicaid expansion is just another word for more expensive health care overall, draining the system.
You believe because of reimbursements we wouldn't see that uptick of folks going to primary care physicians instead of the emergency room?
No, because you have to pay the primary care physicians enough to sustain their practices. And what we know is that half of family physicians are moving into other specialties like emergency room medicine because they can't make a living, and they certainly can't see a significant number of Medicaid patients and going forward Medicare patients to be able to sustain their practices.
His name is John Fleming. He is a member of the United States Congress representing the state of Louisiana. My name is Brad Pomerance. I want to thank you so much for watching Charter Local Edition.